you, Mr. Speaker. Earlier this year in question period, I asked the government for immediate action on the opioids crisis. I said we cannot afford to wait for Bill C-37 to wind its way through the parliamentary process. Ironically, months later, while this legislation has made progress, it has not yet received royal assent. At the time, I asked the government to provide immediate and direct support to communities like those I represent in Essex, which continue to grapple with this public health emergency. Mr. Speaker, unfortunately, this crisis continues to spiral. Frontline workers do not have the resources that they need. People in my community are frustrated and angry by the lack of response from this government. Earlier today, the Health Minister spoke about emergency funding to BC and Alberta. I would like to remind her that communities across Canada need emergency funding. Small communities especially are struggling to deal with this issue when there isn't a holistic plan. Mr. Speaker, we need care in this country that sees people from detox through transition and into rehab, and that's very difficult to find in small communities. We need the government to step up with the resources necessary to bring this crisis under control. In my riding of Essex, youth addiction is a significant issue. In fact, our county has the 7th highest rate of youth addiction in the province. Law enforcement feel that their hands are tied, and they are stuck in the cycle as well, Mr. Speaker. They pick up the same person, bring them to the hospital, and then they are back on the street again. They want to be part of the solution, Mr. Speaker, but there is currently no way for them to participate in that. Families are feeling desperate. When a loved one experiences an addiction, the parents and the family struggle so much. It is life or death. They try to support their loved one in getting help, but there are so many gaps in the system that it often feels like the system is working against them. Families are doing all they can to help each other. This morning, Mr. Speaker, I spoke with a woman from my riding who was trying to help another family save their child. She fortunately was able to get her daughter into treatment, and her daughter is healthy today. But this is not the case for everyone. And if it wasn't for Narconon and family support systems that are cropping up, we would have no formal way for people to be able to find out what treatment is available to them. When someone with an addiction is ready to detox, then go to rehab, it's often the beginning of a frustrating experience of running up against the common problems of lack of beds, long wait lists, and a complete lack of resources. People with addiction simply cannot get the help they need, and sadly, this can have tragic consequences. People not being able to get into help, Mr. Speaker, is heartbreaking. I've met with some of these families. They visited me in my office, and it's a very emotional conversation with people who are struggling to get their loved ones the help that they need. I've heard their pain and sorrow, and more often, their frustration and anger. When families tell me that their only hope is that their loved one will somehow end up in jail, Mr. Speaker, so that they can get the treatment that they need, this tells us how incredibly broken our system is. Since I held a roundtable several months ago, 7 more people have died in our region due to opioid addictions. So I implore the government to revisit their 5-point plans and reconsider the level of resources that this public health crisis deserves. I'd like to ask what the government can do to offer to rural communities like those of mine in Essex to assist with strengthening the response to the opioid crisis.
To Secretary to the Minister of Public Safety.
Thank you very much, Mr. Speaker, and our government is indeed deeply concerned about the growing number of unintentional opioid overdoses and deaths being reported in Canada, including those involving fentanyl and carfentanil. We know this is a complex issue and that no one organization or level of government is going to be able to find a solution on its own. In fact, months ago, we recognized that there was an opioid crisis in Canada, and since then, this government has taken swift and concrete action. We've been working closely with provinces and territories, community organizations, academia, and international partners in all areas of response, from prevention and treatment to law enforcement and harm reduction. We listened when nurses, doctors, pharmacists, patients, and parent organizations told us that removing the requirement for a prescription to access naloxone would allow for a more rapid response to a potential overdose situation, increasing the chance of survival. We applauded the decision of those provinces and territories that have followed this recommendation and delisted naloxone in their jurisdiction. Health Canada has also worked to provide access for Canadians to single-use nasal spray delivery system for naloxone, which has already been approved for use in other countries. This provides our first responders and communities with an alternative to injectable naloxone that is easier to carry and administer in the event of an overdose outside of a hospital setting. In November of last year, the Minister of Health co-hosted an opioid conference and summit along with the Ontario Minister of Health and Long-Term Care, where participants from across the country committed to concrete actions to address this crisis in a joint statement of action. The Public Health Agency of Canada is using tools at its disposal to deal with a national public health event of concern. A special advisory committee on the epidemic of opioid overdose was struck to focus on urgent issues related to the opioid crisis. This committee is co-chaired by Canada's interim Chief Public Health Officer and the Chief Medical Officer of Health for Nova Scotia. Supported by the Public Health Agency of Canada, it includes representation of the Chief Medical Officers of Health from every province and territory. This federal, provincial, and territorial committee provides a mechanism for collaboration and information sharing between jurisdictions focused on improving data gathering and surveillance, supporting harm reduction efforts, and addressing prevention and treatment options. To inform response efforts and to monitor the extent of the crisis, the committee is sharing, coordinating, and analyzing existing data on the public health impact of opioids in Canada. This includes examining indicators, standardizing definitions, and lending support to collaboration between chief coroners and medical examiners led by the Canadian Institute for Health Information. Special advisory committees have previously been established across a cross-jurisdictional mechanism to allow for timely decisions on public health operations and to facilitate policy advice to deputy ministers of health, including significant public health events such as H1N1, Ebola outbreaks, Zika, and welcoming over 2,500 Syrian refugees. Mr. Speaker, I could go on in great length. This is a very serious crisis, one that the government is meeting with all available tools at our disposal for action.
Member for Essex.
Mr. Speaker, I thank the Parliamentary Secretary for expressing his concern, but without action, it's hollow. It's meaningless to people in our communities who are watching their loved ones suffer and die. The government can't only focus on big cities. They have to look, because action is desperately needed in small towns like LaSalle, Amherstburg, Essex, Kingsville, and Lakeshore in southwestern Ontario, who have no ability to get into those beds, who call up the hospital and can't get into rehab because there are not beds that are available. So where does that leave them, Mr. Speaker, with their loved one, who look for a rehab facility that doesn't exist in our region, who have to travel out of town, who have to be on wait lists? Mr. Speaker, rural communities cannot be left behind in the government's plan to address the opioid crisis. My question to the Parliamentary Secretary is, how are you helping rural communities who are being devastated? This government needs to show leadership and declare a national public health emergency.
Parliamentary Secretary.
Thank you, Mr. Speaker. Well, in December, our government announced the new Canada Drugs and Substance Strategy, and I certainly appreciate the member's concern for rural communities. It's one that I share. And this strategy is going to restore harm reduction as a core pillar of Canada's drug strategy. The member also referenced some of the emergency funding put in place. We had recent funding announcements in February 2017 and in budget 2017, including $100 million over 5 years starting in 2017-18. with $22.7 million per year ongoing to support national measures associated with the new drug strategy and implementation of the opioid action plan. And that, of course, would also affect rural communities, Mr. Speaker.
The honourable member for Calgary.